Thank you very much. I'll also start by acknowledging the traditional owners of the land on which we meet and pay my respects to their elders, both past and present, and any other elders we may have here with us today. And that video was a great video to end with and a very positive note. So it's also fantastic to acknowledge Todd Harper, the CEO of the Cancer Council. Thanks, Todd. It's been a pleasure getting to know you and the priorities of the Cancer Council, and I hope it's the start of a beautiful friendship, and I've no doubt it will be. And also Craig Sinclair, Head of Prevention of the Cancer Council, and Jane Martin, who very neatly covered off on a few of the things that I'll also touch on today. But to start with, thank you for organising today's forum, Rethink Sugary Drink, and to everybody behind the Live Lighter campaign. We understand, I think intuitively in this room, the importance of partnership in tackling these very serious and challenging issues, particularly when they're dealing with something that's so ingrained in the everyday life of our community. So it's important that we have all levels of government on board, the community and not-for-profit sector, business, workplaces, all those corners that Jane pointed out in her presentation. All of you in this room are making a real difference to how people live and to improving the way Victorians live. And I thought, given we're going to hear from a few councils today, I'd touch on just a couple of the things that the Victorian government is doing in this space. And we'll expand upon slightly some of the things that Jane mentioned. So, as hopefully you're all aware, the Andrews government is committed to improving the health and wellbeing outcomes for all Victorians, and we know that this is in part achieved by supporting healthy food choices. And we know that high levels of sugar consumption is a growing concern, and we know it can lead to tooth decay, to an increased risk of being overweight, and a range of other diseases. And just earlier, before this session, Todd and I were reflecting on the fact that many people may not fully understand the link between obesity and cancer, and that's perhaps a connection that we need to increase awareness about in the community. And to that end, we know that sugary drinks are a particular concern in our fight against obesity. And to recap on some of the stats that I know Jane touched on, we've got 1/3 of adults in Victoria have sugary drinks once a week or more. We've got 4 in 10 Victorian children drinking 1 or more sugary drinks in a normal day, and almost half of Victorian children eating 4 or more sugar-packed foods or snacks in a normal day. That's pretty substantial. And we know that there's, when we talk on averages like that, we know that there's many that are a lot worse, and I think it's important to reflect on that as well, and how we can improve that. I think these statistics demonstrate a very clear need to cut down sugar consumption and to improve healthy eating habits in our community. This is reflected, as you've heard, in the Victorian Public Health and Wellbeing Plan, and it will continue to be a key priority for this government and I hope successive governments as well. We know that many councils are including a commitment around reducing sugar consumption, and particularly consumption of sugary drinks, in their municipal health and wellbeing plans, and we commend you for this. It's very important work. And the Victorian government currently also has a number of initiatives underway to support this priority area and to support you in your work to improve the health and wellbeing of your communities. We heard Jane mention before the Healthy Choices Policy Guidelines. Thankfully, they are starting to gain traction. We've seen them implemented in schools, early childhood settings, sport and recreation centres, health services and workplaces. And it's essentially about making healthier food choices accessible and easy, because we know that's the key to getting greater uptake. We also have the Healthy Eating Advisory Service, just having launched the Food Checker, which is an online tool to help organisations assess the food and drinks they supply with the Healthy Choice Guidelines. And there are also a number of practical things that government can do to make the task of healthy eating much easier. And earlier this year, in February, the Victorian Parliament passed legislation requiring large food chains and supermarkets to display the number of kilojoules of ready-to-eat food and drinks. And this is designed to make it easier for consumers to make healthier choices when eating out. And I know this is something that has become hopefully a pretty standard part of our day-to-day lives here. And it's interesting to think back to sort of 10, 15 years ago, when the idea of being able to see what your kilojoule, what your calorie consumption is on the foods that you ate, particularly fast food, was almost, it was beyond the realms of imagination, really. But now it's an expectation, and I think to build that expectation in the community that these are that we should be able to make informed choices is really important. The Australia and New Zealand Ministerial Forum on Food Regulation is also considering ways to improve how sugar is labelled on foods, which is a significant step forward. And of course, forums like this are a great opportunity for us to share our ideas and also our achievements, so that we can all learn together from best practice and achieve a healthier community together. So to those presenting today, thank you and keep up the good work. I look forward to hearing as much as I can stay for. And for all of you here to listen, all the best for the remainder of the forum, but also thank you for your commitment to driving better health outcomes in our community. I can't stress enough how significant and important this is. It's certainly something the Victorian Government will be keeping a close eye on into the future, so we can ensure that we are from the bottom up, from as young as possible, to building healthier communities into the future. So thank you very much for being here today.